Morning, this is Aoife from womenshealthdublin.ie. I'm going to talk this morning about overactive bladder. I had a lovely patient in today who's had overactive bladder symptoms for more than 3 years. This means for her that she wakes up 2 or 3 times every night to go to the toilet, and she needs to go every 30 to 60 minutes in the day. So it really affects her when she's at work or when she's, out with friends. She often says even when she's watching TV that she'll go during the ad break just so she doesn't have to miss the movie or the program she's watching. She went for a urodynamic test, which is when they basically get you into the lab and check how much wee or volume of urine your bladder can hold, and then when you go for a wee, how much you empty. And they found that this was fine, that she emptied fine and had normal kind of holding volume. So for her, it's kind of now a really bad habit in her brain as part of it, that she kind of, once she feels any feeling that she needs to go, she has to go immediately and she can't hold it basically. And then often she goes just in case, so that if she's somewhere where there is no toilet, that she won't get caught out. So that kind of starts to teach the brain and the bladder, okay, when I feel any little need to go, I'm going to go. The other thing is then she can't hold it. So that's an urgency issue. I need to go and I need to go now. So the urodynamics came back fine. They advised her to try and start training her bladder and her brain to kind of fight the urge a little bit, to slowly start to push out the time between each time she goes for a wee, basically from 30 minutes to 40 to 50. So she's starting to do that. But she came into me to check her pelvic floor. So she thinks she's doing pelvic floor strengthening so that it helps her hold on if she feels she needs to go. So I did an internal assessment and immediately could tell that her whole pelvic floor activation technique was really bad. Instead of squeezing the pelvic floor, she was actually bearing down. So pushing down as if you're going to push out a poo or push out a baby. That is not going to help you when you're trying to hold in a wee. So instead of the bladder closing, it was more than likely going to open and again help things kind of move down. So what I did with her is spent quite a while teaching her how to actually activate her pelvic floor, how to squeeze it in isolation, how to not use her legs, and really that it's a lifting technique or even a sucking in the spaghetti technique. So used a different few mental cues until she finally got it, and then showed her how to actively squeeze and relax. So now she's gone home to do pelvic floor exercises. Hopefully this means now when she feels the urge to go to the toilet, she can actually hold it well and not feel like she's in a big hurry to go. So it's going to take time for her to strengthen the muscles, and it's going to take time to get out of these habits, and it's going to be just a slow process of always trying to, lengthen the time between voiding or between going for your wee. And then I told her as the day gets better, the night will get better. It's not nice to tell her, oh, hold it in at night and try and go back to sleep. But hopefully as the day gets better, her brain and her bladder will start connecting more and she won't be getting this urge to go through the night and waking her up. So we'll see her back in 4 to 6 weeks, and fingers crossed there's a big improvement. Hope you all have a great day. Bye.